Go.
Hey guys, this is Bobby Kinsman. This is my partner, Kristen McDonald. Kristen, I'm going to palpate some structures on your thorax and your spine. Is it okay if you take your shirt off? And we'll drape you?
Okay.
Awesome. First structure we're going to palpate is going to be the sternal notch. So we're going to locate the clavicle, run to it medially, and just in between the two clavicles on either side is going to be a small notch. It's going to be the sternal notch. And just distal to that is going to be the bony protuberance, which is the manubrium. An easy way to find that is to locate the first rib. I highlighted it here in red. So locate that, run it medially, and you're going to hit the manubrium. Just distal to the manubrium is going to be the sternal body. So you can run this distally. And it's going to be a easily palpatable bone. And then the most distal portion of the sternum is going to be the xiphoid process, highlighted here in red. Okay? Very small bony protuberance. You can also locate that by following the ribs up. And it's going to insert into the xiphoid process. Here on the side we have the costal cartilages. Okay? So the ribs are going to insert into the sternum, and as it gets farther out it's still going to be costal cartilage, and then it's going to change into the more bony portion of the ribs. But while it's still medial, it's going to be the costal cartilage. Here we have the 11th and 12th, which are going to be floating ribs, so they don't attach to the sternum. And the 12th rib, it kind of ends in like a bony knob. It won't run out here, such as the 10th rib. It's going to be back here farther towards the posterior side of the back. Okay, so this is going to be the 12th rib, the floating rib, and just superior to that, we're going to have the 11th rib, which comes out a little bit farther. Okay, so now we're going to locate the spinous processes of T1 to T12. So right here we have spinous process C7. It's going to be the most protruding bony protuberance on the back side of the, well, on the back, not the back side of the back, but right underneath C7 we're going to have T1 located right here, and then T2 is going to be here, and it's going to be in line with the superior angle of the scapula, which is going to be right here. So it's going to be right in line with that. And then here we have, so T2, T3, T4, T5, T6, then T7, again, locate the inferior angle of the scapula, and it's going to run just about in line with that. T8, T9, T10, T11, and T12. Okay, so now we're going to locate the lamina groove. So the lamina groove is going to be just lateral to the spinous processes. It's going to form a nice groove. It's somewhat hard to see, but there's a little bit of an indentation on either side of the spinous processes, and that's going to run the length right just lateral to the spinous processes. And also just lateral to the spinous processes are going to be the transverse processes, which are somewhat difficult to palpate. You have to dig a little bit deeper. Okay, so it's going to be just right about there for spinous process T2, and T3 is going to be just about here. And then you can follow that down all the ribs down to 12. And again, it's just going to be just lateral. Have to dig a little bit deeper, but then you can find the transverse process. I think that's it. Thanks for watching.